So November is the Diabetes Awareness Month. In this month, I'll talk about the topics that are related to diabetes or your blood sugar level. So today I'll talk about testosterone replacement therapy and its effect on blood sugar level and how it can improve the symptoms of diabetes. So I have discussed in my previous video that low testosterone level has been linked to insulin resistance in men. Insulin resistant is when your body needs more and more insulin for the blood glucose uptake into the tissue. Use of testosterone replacement therapy in a patient with low testosterone level induces metabolic changes. This metabolic changes leads to improving insulin sensitivity. Testosterone replacement therapy increases the blood glucose uptake by the muscle cell, thus improving your blood glucose level. Studies have shown that diabetic patients with low testosterone level who started testosterone replacement therapy experience a sustained remission in their diabetes. Testosterone replacement therapy not only improves your glycemic control but also improves your total cholesterol, triglyceride level, and waist circumferences, which is belly fat, which is what most of us want. So make sure if you are suffering from diabetes, have your primary care check your testosterone level, and if your testosterone level is low, talk to your primary care to start you on testosterone replacement therapy to improve your overall blood sugar level and improve your diabetes. Thanks for watching. Hope you learned something about optimizing your overall health. Talk to your medical provider before starting any treatment. Let us know what other topics you want me to cover. Give us a thumbs up if you like the video and subscribe for more videos.